Hi, I'm Meredith, and I am 12 and a half weeks pregnant, and today I am having my first trimester screening at the Prenatal Wellness Center. It is an elective procedure to see if there's any birth defects or things like spina bifida that can be detected. It's basically what I'm told is a probability of our child having this. There is a chance today that we might be able to see what we're having, boy or girl. They said it's generally around 16 weeks, but this is 12 and a half weeks, and they've got a pretty super duper ultrasound machine, so we're hoping to maybe see something. As a child, I did have Wolff-Parkinson's-White syndrome, so that is a concern that my husband and I have with this pregnancy, being that it's my first. I have been evaluated by a cardiologist, but they would like for me to be cautious of it during the pregnancy and may see a maternal fetal medicine physician if symptoms arise. But I think our appointment is about 15 minutes away, and this will be my first of hopefully many videos that I'll be able to bring to you guys to follow me through my pregnancy. And our due date is September 21st, 2010.
The purpose of first trimester screening is to try to identify common chromosome problems with the baby at a very early age so that parents can make informed decisions about how to continue with the pregnancy, what sort of testings they'd like to do, what sort of procedures that they would like to go through next. Many parents may opt not to do anything beyond the first trimester screening. However, other parents do choose to go on and do amniocentesis or other more specific diagnostic tests.
And we measure the baby head to toe, and then we're going to measure the nuchal fold, which is the back of the neck here, and they put it all together. You get your fingers stuck and they put it all together, and that's how you get your results at the very end. Nuchal translucency is this little space back here. All babies have it. It's just thicker in babies that could have cardiac defects or like the Down Syndrome. Your baby's looks perfect, so we just have to get a few different measurements. So the back of the neck, the nuchal translucency looks great, and with you being young and it being normal, that's good by itself. We'll put that with the blood work like I told you, and then that's what we'll get your risk for your pregnancy for.
That'll be in about a week.
In about a week, yeah. And you'll probably be able to see, are you able to get in practice partner and see it?
No.
Well, Dr. Villers will call you. Usually they don't get a call if it's normal. No news is good news, but I know you. Anybody in the medical field wants to know, or any dealing with the medical field, they just want to know immediately. So about 6 days. Looking at the spine here. Baby's still laying on it. What'd you feed the baby for lunch? Some turkey? Right to sleep.
I had salad. We did have chicken on it.
Just hanging out in there. And I really don't see a lot sticking out from between the legs, though that would convince me it was a boy for sure, so. Little feet kicking.
Still got its crossed still?
Yeah, right at the ankles. I can't get a definite, even at 80-20 at this point. It's usually what I give.
Stubborn.
I mean, hey. The 20-week one will definitely be a lot of fun, I'm sure, for you. You gotta make sure you eat something with sugar in it.
I have your first trimester screen results back, and they look great.
Awesome! That's such good news. So, Dr. Chang said if I saw negatives, that's when I should ask questions. So I assume you say there's no negatives.
It is...
Or all
Well,
negatives.
it's negative, meaning normal.
Okay, great.
Okay.
Negatives mean normal.
So I have some numbers for you, and that'll make more sense to you.
Okay, I'm ready. I've got a
You ready?
notepad.
Okay. So you first, the detection detection rate for Down syndrome with this test is 85%. Detection rate for trisomy 18 and 13 is 90 to 95%. So the Down syndrome risk that you started with was 1 in 727. So
Okay.
that's the same as everybody who's 29 at delivery.
Okay, perfect.
And then after the testing, you have a risk of less than 1 in 10,000.
Wow.
So well less than a 20-year-old's risk.
That's wonderful.
Yes, it's very good. And then for trisomy 18 and 13, the risk that you started with based on your age was 1 in 1,312 because it's less common. And after the screening, it's also less than 1 in 10,000.
Wow.
So you got the lowest risk that you can get on this test. So you get an A+.
Perfect. That's what I like to hear.
Just like your grades in school.
That's right. Now tell me about that. Can you tell 18 trisomy?
18 and 13. So
What is that?
Down syndrome is an extra 21 chromosome, and trisomy 18 and 13 are two different abnormalities, but they have the kids that have trisomy 18 have an extra 18 chromosome, and they have severe problems that cause death. And trisomy 13 is an extra 13 chromosome and also severe, causing death. So the second part of the test is a combination of screening for both of those.
Okay.
And it's quite accurate.
Awesome. Well, that's good news.
Okay? So it all looks great. And so in the second trimester, what your doctor's going to do is get your AFP test for spina bifida. And so that's a blood test also, and it's going to be done around 15 to 20 weeks.
Okay.
And they'll just do that at one of your regular visits.
So you said ASB, is it initials?
No, AFP is in Paul.
Paul.
Initials, yeah. And it stands for alpha-fetoprotein. So that's a protein that's in all babies, and they have it in their blood. But it comes out in their urine, and so it crosses into the across the placenta into your bloodstream.
Okay.
And we can check it by just drawing your blood. And we check it because babies with spina bifida will have an opening in their skin, and they'll leak out a lot more than you would find normally just from the urine.
Well, perfect.
Okay?
Well, I appreciate you calling me, Sally.
Sure.
Thank you.
You enjoy.
Thank you. Bye-bye.
Bye-bye.